Inflamed emotions and the immune system. Welcome to this new transmission where we read every week a little fragment of the book, The Myth of Normal by Dr. Gabor Maté. My name is Angela Potes, for those of you that do not know me, and I am trained in compassionate inquiry, the therapeutic modality that Dr. Gabor Maté developed and teaches. And I take the opportunity every week to read on his book, The Myth of Normal. How trauma, illness, and healing in a toxic culture. And today we're going to start reading chapter 5. I'm going to divide this chapter into different live transmissions. Welcome all of you. I welcome you to this space. Feel free to write your comments, your questions, and let's dig in. Mutiny on the body, the mystery of the rebellious immune system. A lot of times I've had to pretend I felt good when I felt terrible. Venus Williams, this is a quote by her. I kind of injure myself, me okay, told me recently, because I was doing very well and then I tripped, running up a flight of stairs. So I stubbed my toe. Her warm, impish humor radiates in the telling, and thus a certain sense of pride. For most of us, that would be an odd reaction to a painful mishap like that. But to the Mi'ok of 7 years ago, such an injury incurred while moving vigorously against gravity would have seemed like an impossible dream. Diagnosed at age 27 with scleroderma, she had become completely disabled in a short time, despite all that mainstream medicine had to offer. She lives in the Boston area and was, in a sense, treated by one of the Western medical sciences' most hallowed venues. From the Greek heart skin, scleroderma is an autoimmune disorder that manifests in debilitating joint inflammation and painful tightening of the connective tissues. A more inclusive name for the condition is systemic sclerosis, as the buildup of hardened tissue can occur in many organs, including the esophagus, blood vessels, and lungs. In Mi-Ok's case, it showed up in agonizing swelling of her hands, shoulders, and knees. The pain was everywhere, she recalls. It flooded my whole body. She soon had to leave her job at Harvard as an assistant to a prominent academic. Formerly an 120 word per minute typist, she now found her hands becoming rigid and claw-like, stiffening into near paralysis. Merely touching the keyboard was agony. When I first interviewed her in 2014, her physiognomy was grim. Her face a rigid mask. Her taut lips barely able to cover her teeth. She was unrecognizable to herself and wholly incongruous with the person one encounters now. Her smile quick and responsive. Within a few years of the onset of her disease, still in her early 30s, Mi-Ok wanted only to earn her life. Facing a death sentence diagnosis, needing a wheelchair to mobilize, unable to even to get out of bed without assistance, and anticipating that her torments would only intensify the longer she lived, she investigated the possibility of medically assisted suicide. If I had been in a country where euthanasia was legalized, I would have fit all the criteria. The pain was unbelievable, she told me. There was no prognosis that really gave me a reason to stick around. I was losing my body so quickly. I knew that if I waited much longer, I was going to be trapped and I wouldn't have even been able to push a button. If you are experiencing chronic illness or depression and anxiety, which is categorized as mental health illness, and you just have that unbearable situation where you feel that you want to end your life, I want to mention that I'm here with you, and that if you're seeing and looking at this content I invite you to stay until the end, because this case, the case of Miok, is a case of full remission from her illness. And this can be you. There is a way out. Today, in defiance of all conventional medical logic, Miok, completely off all medications, walks, travels, and hikes independently. She is currently writing her memoir, albeit at the speed of 50 words per minute, relatively to the shape she was in not long ago, a true victory. Scleroderma is among 80 or more related conditions dubbed autoimmune, each representing a virtual civil war inside of the body. In effect, autoimmunity amounts to an assault by one's immune system against the body one ought to defend. The particular form of the disease depends on which tissues or organs become the targets of this ruined internal rebellion. In the nervous system is under fire, the result may show up as multiple sclerosis. If the gut, celiac disease, or inflammatory bowel disease, IBD, such as Crohn's or ulcerative colitis. If the joints and connective tissues, systemic lupus, erythematosus, SLE, or rheumatoid arthritis, RA, or scleroderma. If the skin, psoriasis, or autoimmune eczema. If the pancreas, type 1 diabetes. If the lungs, pulmonary fibrosis. If the brain, perhaps Alzheimer's. In many of these conditions, several regions of the body are affected at once. Chronic fatigue syndrome, also known as myalgic encephalomyelitis, ME, which affects millions worldwide, is affected to be best known of the recent additions to this roster. Virtually all autoimmune diseases are characterized by inflammation of the afflicted tissues, organs, and body parts, which explains why frontline medical measures often begin with anti-inflammatory drugs. That makes sense, right? When non-steroidal anti-inflammatory like ibuprofen or heavier artillery such as steroids themselves prove inadequate, physicians may prescribe medications to suppress the body's immune activity. Because the disease had first affected Miok's joints, the doctors believed it was rheumatoid arthritis. Their prescription was steroids, lab-made analogs of the natural stress hormone, cortisol, a secretion of the adrenal gland in response to a threat. Ultimately, it was the failure of both steroids and immunosuppressants that drove Miok to suicidal despair. Her doctors had nothing left to prescribe. Gabor goes, I should add that Miok's illness was so extreme that her recovery is entirely unexpected. Indeed, unexplainable, according to standard medical thinking. I contacted her family physician in Boston, who verified the details. Although often disruptive and highly distressing, autoimmune symptoms can be nebulous and hard to pinpoint at first. Not so much the patient suffering them and seeking validation and support as to the physician in search of precise findings. Hence, it is not unusual for such diseases, which not infrequent overlap with each other, to fly under the diagnostic radar. Such was the experience of the tennis star Venus Williams, whose illness expressed itself in swollen hands, persistent fatigue, and misshapen joints. Symptoms that would be alarming for anyone, even more for an elite athlete. I go to doctors, but never get any answers. There was just nothing I could do but keep going, she told a newspaper reporter. You almost get used to having all the symptoms, she said. You tell yourself to shake it off, just keep going. Over time, you do start to wonder what's happening and if you're going crazy. Is this something that is happening to you? Have you been normalizing symptoms in the body because you haven't been able to find diagnosis, prognosis, and things to resolve the issue? And have you gotten to that point, like Venus Williams is reporting here, describing here, that you can think that you're going crazy? I remembered when I was when I was diagnosed with depression and anxiety chronically for so many years, I went through that, and I actually did not really quite understand why my situation was not resolving itself, and why and then I just kept thinking that I was crazy, something was just completely off here. If this is, happening to you, I'm just curious. Not in the sense that I want to give you a low note on this live transmission. On the contrary, it means that there is something in you that is looking for a different answer, and there is a different answer. So just leave it in the comments. I'm very curious. She eventually found, this is Venus Williams, to have Jorens syndrome, a condition that primarily affects moisturing-producing glands so that people suffer dry mouth and dry eyes, but which can also cause dysfunction in many organs, such as the lungs, kidneys, pancreas, and blood vessels. Like many others, Williams was relieved to finally learn there was some objective reason and even a name for her physical tribulations. In Mioch's case, it fell to the patient herself to make the diagnosis. A not unusual role reversal in the internet age, particularly in cases where doctors have already thrown up their hands. My body just continued to stiffen, she recalled. It was like it was undergoing mummification, like a self-mummification over time. It kept spreading and spreading through my body, and the pain was just unbelievable. They were giving me steroids and telling me that it was something that I would have to maintain, that the arthritis would never be cured. It wasn't curable. I insisted on being tested for scleroderma, and that was when I found out my diagnosis, 6 months after the symptoms started. Autoimmune diseases are among the great unresolved mysteries of medical profession. Most are considered idiopathic in nature, which simply means of unknown origin. Naturally, if we cannot identify the cause of a condition, in many cases, symptom suppression or sometimes surgical repair or removal of damaged tissues is the most modern medicine can offer. Such measures do afford welcome relief to many, but they cannot reverse the course of disease, as with Mioch, leave a great number of people consigned to prolonged deterioration and disability. Troubling at this lack of clarity is for doctors and patients alike. These illnesses also present a number of other head scratchers, scientifically speaking. The first mystery is why they're becoming more frequent. Across many Western countries, rates of everything from celiac disease, listen to this, to IBD, from lupus to type 1 diabetes, and even allergies are steadily rising. Stamian researchers. In the last half century, the prevalence of autoimmune disease has increased sharply in the developed world. A 2016 New York Times article noted an estimated 1 in 13 Americans has one of these often debilitating, generally lifelong conditions. In the UK, the diagnosis of Crohn's disease increased more than threefold between 1994 and 2014. While in Canada, the rate of IBD in children grew from 7% a year between 1999 and 2010, giving my country among the highest rates of this disease in the world. Such trends immediately rule out that go to off medical explanations, genetic causes. Whatever effects genetics may exert, and no doubt they figure in some cases, logically, they cannot account for the rise in prevalence of autoimmune disease. Genes do not change in such a short period of time. Virginia Ladd, chief executive of the American Autoimmune-Related Diseases Association, told Medical News Today in 2012. The rapid increase of autoimmune diseases clearly suggests that environmental factors are at play. In other words, something in our environment or a combination of something else is inflaming our bodies. For most of us, when we hear environmental factors in conjunction with disease, our minds tend to go to well-publicized material factors, right? Such as air pollution, lead paint, and and radiation. One interesting but unproven theory has it that the rise in junk food consumption is responsible for the globally increasing prevalence of autoimmunity. Studies have not yet identified such a link. Either way, a complete understanding of health and disease requires a far more encompassing view of the word environment, a biopsychosocial one. The second mystery is the highly skewed gender distribution of autoimmune disease. About 70 to 80% of sufferers are women, among whom which such conditions are a leading cause of disability and death. Rheumatoid arthritis, for example, is 3 times more likely to strike women than men. Lupus affects women by a disproportionate factor of 9. Meox's condition, systemic sclerosis, is 3 times more common among females. Even more of a puzzle is why the gender imbalance is increasing in, for example, multiple sclerosis, a chronic, highly debilitating, potentially lifelong disease of the nervous system. In 1930s Canada, the gender ratio was about equal. Nowadays, more than 3 women are diagnosed with MS for every man in the country. The trend is reflected internationally. There is an increasing incidence of multiple sclerosis in women in Denmark. Danish women risk of developing MS has more than doubled in 25 years, while it has remained virtually unchanged for men. Noted a recent article in the Danish Medical Journal. Then right in front of in line with Dr. Latt's observations, the explanation for these epidemiological changes should be sought in the environment, as genetics only explain a small part of the MS risk. The changes are too rapid to be explained by gene alterations. I'm going to repeat this. The changes are too rapid to be explained by gene alterations. None of the specialists who looked after Mioch inquired about the conditions, physical and emotional, that preceded her life-blighting illness. This despite the voluminous research that linked stress, trauma, and inflammation, and despite the multiple studies that over many decades have explored such connections in rheumatoid arthritis, in MS, and in other autoimmune conditions. Not only are such possible sublines of inquiry are not pursued, but they seem to be verboten in mainstream circles. I've come to feel a little bit off the wall when talking about these issues, especially in rheumatoid diseases, as one of the best US teaching hospitals told me. Since my graduation, I have markedly changed the way I practice because I started observing in my patients the relations between stress and the onset of their disease, and how great a role trauma, psychological and physical, plays in their disease. This doctor, who requested anonymity for fear of alienating herself from colleagues, has observed firsthand that she calls remarkable results among her patients, both in terms of recovery and even in some cases getting off medications altogether. Yet she feels like a renegade in her own profession. I'm surrounded by all my, esteemed colleagues at the university who are investigators, and nobody's looking at these things. Hearing this, I recall the Harvard physician who told me that the doctors follow this sort of threats as their own peril, though he did think it was changing. Even if doctors who stray beyond medical orthodoxy can feel intimidating and misunderstood, what do patients experience? Another lamentable feature of Western medical practice, not universal but all too often seen, is a powerful hierarchy that casts physicians as the exalted experts and patients as the passive recipients of care. For all doctors' dedication and goodwill, the imbalance compromises patients' agency over their own health and healing process. Essential questions about their lives go unasked, while patients in turn lack the confidence to insist that their intuitions and insight about themselves contribute to the process, much less guides it. And I will stop with this reflection. How is the agency on your own health? Are you working with a team of clinicians, physicians, professionals that are taking in your consideration your own intuitions, your own insight, your stressors, your trauma, your experiences? Because this is essential in the healing process. We don't go to doctors to rely on answers and for them to give us solutions. We work as a team. Once you do this, once you gain back that sense of agency, you're going to see how the healing process really resolves itself because all of the answers lie within you. With that being said, we will continue with this chapter next week. I wish you a beautiful weekend, and let me know your comments. Let me know if you're liking this content. Let me know if you have any questions. I'm very open to answer to the best of my capacities.